Your smile is your biggest asset. You can't afford not to smile. If you're uncomfortable with your smile or if it embarrasses you, it's going to affect your everyday interactions with people. People who love their smile smile big and they smile often. And having a great smile is a huge help with your career, with your relationships, and with your overall self-confidence. If you're unhappy with your smile, I can help you do something about it. My name is Dr. Robert Soto, and I'm a general and cosmetic dentist in San Francisco. In this presentation, I'll review the process of improving a smile with porcelain dental veneers. We'll go over 2 veneer treatments and discuss the steps involved to get our final results. When I first meet a patient seeking a smile improvement, I need to determine how many teeth need to be worked on and what type of results my patient is looking for. My patient is a professional and he wants to be confident in his smile when he meets clients. He'd like to close the spaces and lighten his teeth. In order for me to give my patient an idea of what's possible and for me to test out my idea for closing the spaces, I complete a composite mock-up. I simply add composite filling material to his teeth and shape it to give us a rough idea of what veneers could look like. Many photos are taken with and without the mock-up in. Together, we can decide on how many teeth to treat and the length and shape of the teeth that we're looking for in his smile. He chose to have 8 dental veneers and we decided to whiten his lower teeth. 8 veneers will be enough to drastically improve his smile. The limitations are that we can only make the veneers as light or slightly lighter than his lower teeth. Also, he shows a few more natural teeth on the top and the back when he smiles wide. Veneering these would give us an additional aesthetic result. After making decisions about the details of the veneers, I have the veneers designed in wax. I'll show these to him for his approval before starting. We will take a mold of the wax and use it to make temporary veneers. I also have the patient wear whitening trays for the next 3 weeks. At the veneer preparation appointment, I prepare the teeth for the dental veneers and take impressions along with other records and photos. I place temporary veneers over the teeth at the end of the appointment. The temporary veneers will allow the patient to see what the final veneers will look like before they are made and permanently cemented in. I usually see the patient 2 to 3 days later to make sure they like the temporary veneers or make slight changes. Typically, I deliver the final veneers 2 weeks after the preparation. Here we have the final veneers. This treatment took a total of 5 weeks due to the teeth whitening. All the spaces are closed and the teeth are lighter and he can smile now with confidence. Let's take a look at another veneer treatment. This patient wasn't exactly sure of what he wanted. He meets with clients often and knows he wants to improve his smile for that reason. He wanted to know what suggestions I had. We discussed the unevenness of his forefront veneers, the wear of the canines and premolars, the broken crown on his molar, and the spacing of the lower front teeth. We looked at how each of these problems affects his overall smile. He decided to treat all visible teeth. This means 10 upper teeth and 6 lower teeth. Since we are treating all visible teeth, there was no need to whiten. We proceeded with wax model impressions. The models took 1 week to make. The teeth in the wax models are designed to be symmetrical. They build back the cusps he had worn away, and the teeth are slightly longer to make up for the wear. Over time, our lips sag. As the lips sag down, we show less tooth structure. By lengthening the teeth, we can make the smile look younger again. Once we have the wax models, we can begin preparing his teeth. In one sitting, all of the teeth are prepared for the veneers and temporary veneers are placed. I'll see him back in 3 days to make sure he likes the temporary veneers and make changes if needed. The temporary veneers are designed to look like the final veneers. If the teeth are too long or too short or the color needs to be different, I'll let my laboratory technician know about these changes before making the final veneers. 2 weeks later, we can deliver the final veneers. The total time for this treatment is 3 to 4 weeks. If you are interested in cosmetic dentistry and would like to find out more about this type of treatment, please call 415-398-8555 or send an email to info@sfveneer.com. Thank you for watching.